How to identify if someone had a stroke. A person can have a stroke, or a disturbance of blood flow to the brain, without even realizing it. The stroke victim may suffer severe brain damage when people nearby fail to recognize the symptoms of a stroke. It is the third leading cause of death in the US and the UK and causes 10% of. It is important that you know how to recognize one, especially if you spend time with someone who has the risk factors associated with stroke. Treatment is available to minimize the damage caused by stroke, but the person must reach a hospital for evaluation and treatment within 60 minutes of. Know the symptoms of a stroke. Sudden numbness or weakness of the face, arm or leg, especially on one side of the body. Sudden inability to talk or understand what is being spoken to you. Sudden confusion or disorientation. Sudden trouble seeing in one or both eyes. Sudden trouble walking, dizziness, loss of balance or coordination. Sudden, severe headache with no known cause. Headache is more common in the case of hemorrhagic strokes, but can accompany all types of stroke. Find out if the symptoms are new. Any of these symptoms can be caused by other conditions, but what makes them characteristic of a stroke is that they appear suddenly. For example, a person may have had an injury in their childhood that prevents a part of their mouth from moving. In such a case, it is not caused by a stroke and does not require emergency treatment. Seek immediate emergency treatment. If any of the above symptoms are suddenly present, call your local emergency number and tell the dispatcher that you believe this person has had a stroke. You may be asked by the emergency operator or dispatcher to ask the person some which are outlined in the next step if the person cannot be reached by emergency staff quickly enough. When the person is picked up by the ambulance or admitted to the hospital, let the staff know that he or she may have had a stroke. Prevent the person from eating or drinking until they can be tested and treated by trained medical personnel. Over 1/3 of people affected by a stroke have subsequent swallowing problems which can lead to choking or aspiration.